a nursing home. I have been involved in aged care for a long, long time. Basically, I'm a GP of 40 years, but now I've gone into this new business. I had worked with the Little Sisters of the Poor in Jelapang for 10 years on a voluntary basis. Then I decided to open up my own nursing home known as True Happiness Nursing Home in Thompson Road. And I was not happy with the facilities and the building because it was being rented out. So I sold it off. And 10 years later, I started this business, Dr. Thomas Care Center. Okay. And our core business is basically aged care, but we are also specializing on post-stroke therapy, post-stroke rehabilitation, and any after hospitalization, they can come and stay with us, and we will get them better, and we basically send them back home. Our team has got a doctor, that's me. Every day I'm here from morning till evening. Then we have got a staff nurse of 10 years experience from Pantai, who I brought her over to my center. We have got a Chinese cook, and we have got, the rest are all caregivers trained by me and my team personally. Okay, and our organizational chart, actually, I am a doctor there. I am the responsible for running the whole show. And then next to me is Geeta, who's a staff nurse, well qualified, and she's in charge of the whole system. And she's also in charge of the kitchen to see that the food is well cooked, how is it going on and all that. We have got a physiotherapist attached with us. His name is Jude. I think he also comes to your center on and off.
Yes, true.
We have got 2 other junior physiotherapists attached with us. And the main physiotherapist, his job is to first assess the patient and give a complete rundown as to what is happening and what he can do and what he can achieve. And then he will put his charges. The first consultation is free of charge. No charges attached to it. The junior physiotherapist, their job is to carry on with whatever Jude has done. And then the third line of physiotherapist is the one who does the passive job, passive movements and active movements. Those are the simple movements which every old patient needs. Then we have got a psychologist attached with us. She's mainly in charge of cognitive therapy. So every day from 10 to 12, we have got therapy going on. That is at the moment free of charge. We don't charge them anything like art therapy, dancing therapy, mainly all cognitive, for the cognitive development. Then we got a dietitian, but the dietitian is not much of help to us because we don't need much of dieting going on here.
Yeah.
And cook, she's a Chinese cook. Our menu is changed every 2 weeks once. Coming to food, we have got breakfast, lunch, dinner. We don't serve pork, we don't serve beef. And in between, we have tea and coffee. Otherwise, is there anything else you all want to ask us?
Okay. I'm just checking through. Normally, do you have any like the staff to residents ratio back at your nursing care there?
We only got 16 rooms.
All right.
Either double or single. And all rooms attached bathroom, and all rooms are aircon. So we don't take in too many. At the moment, we have got 6 caregivers, 1 staff nurse, 1 doctor, 1 cook.
Doctor, can I ask, in addition to in-house care, would you also be able to offer geriatric medicine for outpatient?
No. No. I am a doctor here basically to monitor the progress and also to warn the relations, okay, this is going wrong, you please go back to your specialist. Well, most of them come here with their own specialist, so they go back for their follow-ups. So we just monitor, that's all about it. And we continue whatever therapy the specialist gives. We don't prescribe.
Doctor, does that mean that people come to you directly from the hospital? We can't come to you without a recommendation from the hospital or a specialist?
No, not to my center, but you can come to my clinic.
Which is attached?
It is not attached to the center, it's separately in Falim.
Salim.
Any other questions?
I beg your pardon?
Any other, sorry, I'm just asking them if anyone else has any other questions.
Yes, please. Dr. Thomas, we would like to know your pricing structure, prices of the rooms for the service. Give us an idea.
Okay. Our double room is 3,250 basic. But if you need a ripple mattress, we charge you a fee for the ripple mattress monthly, which is 50 ringgit. At the moment, these are all the charges at the moment. And then we have two kinds of bed. One is a hospital bed, and then the other one is a normal, simple wooden bed. Some of them like the simple wooden beds. And then Riles tube, separate charges. Insertion of Riles tube, separate charges. Maintenance of tracheostomy is a separate charge. And then we have got oxygen. Oxygen is you have to pay on a monthly basis of 350 ringgit a month. And then the single rooms are 5,005. And I'm sure you would like to know about the charges for the physiotherapy. It depends. You see, we are also we also go back to the background of the patient, see how good he see financially, and depending on that, we will charge. It's normally from 70 to 90 a session. But the initial assessment is free of charge. Consultation is free of charge.
Thomas, do you have any photograph or any videos that you can share to us about how practically the rooms or facilities that you have?
You can just go to my website.
Go to the website. Okay.
Go to my website. You can also go to my Facebook.
All right.
All there. Everything is there.
Okay.
Is there a long waiting list to get in, or would it be?
No. At the moment, no. At the moment, no. But we are very, very strict because of this COVID. So we do a COVID test personally here. We also facilitate the vaccination faster by informing my physiotherapist about the urgency of the vaccination. And my center is fully vaccinated because the government has come and vaccinated all of us, including my workers. And when you come in, we have got an agreement to be signed. And we take a 1 month deposit, which is fully refundable. At the end of the month, we send you an invoice and you pay into our banks.
Nanti tidur?
Ya.
Hai?
Saya turun.
Apa?
Saya turun.
Tak saja saya satu.
Can I make a suggestion that all the participants mute your microphone so that you do not, accidentally come into the picture, because each time you speak, your face appears. Actually, Doctor, I have a question. You quoted a while ago that those are the monthly rates. If a person needs less than a month, for instance, he needs just 1 or 2 weeks of care, is that possible?
It is possible, but if suppose two of you come, say one person says, I want to stay 2 weeks, other person says, I want to stay for about 1 month, Basically, we ask for more than a month because it's much more easier for us to function. 2 weeks, what can we do for you? We can't do much. As soon as you come in, we are assessing you. Then we go through your whole body system. We go through all your clinical things. If there's any bed sore, what is there, everything is noted to the relations. And then from there, we move on. And our main idea is to make sure everything is done well and everything is taken care of well. We are open for suggestions from the relations, from the relatives.
So would you do a long term? If so, how long?
It depends how long you want. Oh, you're asking me what is my minimum? I would suggest is a month.
No, I mean, let's say ongoing nursing care till the end, maybe. Yeah.
Yeah. We do all those things. There are some of them who are staying with me already a year. Some of them have come and stayed with me 5-6 months and passed away. So we are open for everything.
It's good to know.
How about you? Yoo-hoo. Rosie?
Okay, coming to dementia, we have got a few dementia patients here, but we are very particular in how they behave. If they are very noisy and disturbing, then no. But if not, then we will bring them in here and then we will treat them with cognitive therapy. I think there's a moment of disturbance here.
Let me unmute.
James?
Maybe you're not doing have the recording yet. Now
Hello?
it's un-
Dr. Thomas, while we are waiting for whoever is preparing to ask question, at your Falim clinic, can we come and see you for ongoing geriatric advice so that if we need some kind of treatment, then you will have all our details or whatever?
You are muted, doctor.
Dr. Thomas, you're muted right now.
Can you hear me now?
Okay, so I'll ask my question again. Doctor, I was asking if we could come to your clinic in Falim.
Yes.
To start, say, geriatric advice, and maybe later, if we need to consult a doctor, you will have our records, kind of thing.
Obviously, definitely, there's no problem. That's no problem. At times, I do house calls, but now because of COVID, I'm not too keen to do. But I'm basically for the aged care because I'm also planning to start an aged care academy here in Ipoh. I had the license when it was about 2 years ago, but then due to political reasons, it was taken away when Barisan National lost the elections. But I'm very keen, but I'm very much involved in aged care.
Please start it in the Maru area.
Mm. I am planning to expand it later on, but right now with this COVID problem, we are just stuck with what is happening here. Because I got also plans of training maids, how to take care of elderly people, so that the maids will know what to do exactly with an elderly person, how to transfer a patient from the bed to the wheelchair, wheelchair back to the bed, how to bathe them, all the basic things. But then, to be very frank with you, I don't employ foreign workers in my nursing home. For the simple reason is, I have had some bad experiences with the other home when I was having it. But here, I select my caregivers to be at least more than 35 years old. And I go through them very well, and they have to have a passion on it. They have to have a passion for aged people, otherwise no. You should make a visit to my center one of these days.
James, take note.
Mm.
James, also take note about the training that he does for caregivers and all that.
I've been to your center. I've been to GreenAcres once, and I was not allowed in, but then I had to bluff and say, my mother-in-law wants to stay, can I have a look? So I had a good look. You all have got fantastic facilities there. But I didn't get a chance to get into your rooms or your place where you all are living. But all I gathered is that you have to employ your own maid, you have to do your own cooking and all that. And I don't know whether you are aware, there was a questionnaire taken up earlier. There was a questionnaire earlier whereby they asked, would you go and stay in green care? So most of the answers, 80% of the answers was, if I'm not able to walk, I need assistance, I would go to an aged care place. But if I'm able to walk and all that, I may still rent a house and stay.
The concept right now is independent living, because that's on basis on which we came to GreenAcres, and we expect to be able to live independently for several more years. I don't know how many more, it all depends. But we will all reach a point where we will need care, but maybe initially only partial, but later on maybe full-time. So we have to identify facilities that can help us in those areas.
Good.
Currently, we are all mostly independent, and we stay active. We want a quality life, that's why we are here. But at the same time, we want to have all these services in place so that in case we need, we are not stuck.
Okay, fair enough. You all can go into my website and you can see what all we are doing. Most of the things what we are doing, like activity, cognitive therapy, because we are more into therapy. Okay. Of the 18 people I have in my home, there are only about 6 of them who are aged, but they are all still walking and all that. The rest are post-stroke patients. Those who are hospitalized and they can't afford to stay in Eco Specialist Center and all, they can come and stay with us for a month or two, get themselves well, and they go back. So we do also the rehabilitation part of it.
Residents, any other questions for Dr. Thomas?
I'm David.
David?
How are you? Good.
I'm doing
I have
well.
questions. Hello.
Okay.
Hello, everybody. Okay, just an inquiry, Dr. Thomas. If let's say those the patient or patients in your center, if let's say that in a way that they're not mobile, quite dependent, can we get a maid for just to take care of the patient?
Yes,
Stay in.
Yes. I have got one person like that who has come in with a maid, And the charges are the same. You see, we will charge the maid also because she's going to eat. She's going to occupy a bed. So it goes that way, but we allow the maids to come in. But we tell the maids straight away, care is ours. Whatever side job you want to do for her, for the person whoever you're taking care, you do. But the rest is ours. We don't allow her to interfere into our job. Neither do we ask her to do any job in our center.
Okay. Okay, thank you. Thank you.
Thanks. Nice talking to you.
Hi, James.
Unmute John.
Yes, William, you got any questions, William?
Yeah.
Yes, I see some opportunity here.
Yeah, you saw that. That's what I'll be
Yes.
discussing with Dr. Thomas.
Yeah, good. Yeah.
Dr. Thomas, later, would you be able to spend about 10 to 15 minutes? I need to call you and talk to you directly.
No problem. But make it fast because I'm waiting for 2 or 3 clients to come in before 12.
All right. Okay, I'll give you a very fast one. All right, residents, any other questions for Dr. Thomas?
Just one last one, Dr. Thomas, because some of us have been to a few nursing homes just to make sure we know what is available where. So one more question I would like to ask you, okay, if your patients need like diapers and all, would you allow us to buy on our own, or would you insist that you supply at your price?
No. You can buy yourself. See, what I do is, we are not very, very commercial because it is already a strain putting your relations or your mother or father in a nursing home. So the Pampers and all that you can buy yourself. You can buy from Shopee, which is much more cheaper, and send it to your center.
Thank you. Good to know.
No. We as far as possible, even other things like we will give you a checklist as to what you got to bring in, and then that's all you can bring. We'll try our level best to cut costs. Our charges are just staying. Even I don't charge a cent. Doctor's fee, there's no doctor's fee.
Thank you very much, doctor, because some of these homes, nursing homes, are very commercial. I mean, their main objective is to make money. It's nice to hear that.
If you have a look at my nursing home, in my room, I can easily put 3-4 people, but I don't want. I want it either single or double, that's all. That's all. And then you got a choice of telling us, how's the food? What is the food like? I'm not happy with this. I'm not happy. They always, every day I'm here morning taking a round to find out what's happening in the center, because I want to make this a kind of its own. And you can always call me. I will give James my phone number or whatever it is. You can always call and speak to me. I didn't get your names.
Okay, I'm Rajesh, and this is my husband, Singham.
Okay. Right, Singham.
Any other questions, residents? Okay, if there is no other question, we will wrap this up. I'll call you in a few minutes, Dr. Thomas.
Yeah, okay. You're calling me on the phone or what, on this?
On the phone.
Okay, right, thank you.
All right, I'll call you directly.
So I'll go out of line.
All right, okay, if there's nothing, I will end the session.
Thank you.
All right, thank you all.
Thank you.
All right.
Nice talking to you all.
Thank you. Yes.
Thank you.
Yeah.